This is one of the most surprisingly frequent group of symptoms that women seek help about. It's also a group that many women do not recognise as being associated with the menopause. Many say that they're surprised they're consulting a gynaecologist when they've effectively got psychological problems. But of course the key is the declining estrogen levels that's associated with the menopause, which can have a huge impact on brain function at all levels. Women commonly experience symptoms which fall into two groups. The first group is cognitive function. So women may present worried about their memory, their recall, day-to-day function, their ability to multitask, their ability to concentrate, remember simple things like names, and so on. These are symptoms which suggest declining cognitive function, almost certainly due to declining estrogen levels, which occurs in the menopause. The second group of symptoms is the psychological group. Commonly a sense of anxiety, which can come on in the menopause for the very first time. Women may even present with panic attacks and phobias when they've previously had very stable backgrounds. Low mood is another issue, certainly more common than bipolarity, and many women can present with depression, again for the very first time, with no previous history. There is a direct link between the estrogen changes at the time of the perimenopause and menopause and the psychological and central nervous system symptoms which women suffer. This is due to the fact that certain areas of the brain, particularly those associated with mood control, with anxiety and with cognitive function, such as the limbic system and the hippocampus, have very high receptor levels responsive to estrogen. So obviously when the levels of the hormone start to decline, the receptors are no longer fed properly, they don't function properly, and symptoms and side effects can arise. The sort of treatment that I would recommend a woman seeks if she has psychological symptoms will depend very much on whether she has additional menopausal symptoms as well. For example, flushes and sweats, poor sleep, tiredness, and other physical symptoms. In this group of women, there is no doubt that HRT can be a huge benefit across the board, but even in women who have isolated psychological symptoms, there is a lot of scientific evidence that estrogen replacement should be the first-line treatment for mood problems. It certainly performs better than SSRI and other forms of antidepressants and has fewer side effects. I would always recommend my patients seek help in any way that they think may be beneficial. I don't think that HRT should be used in isolation, and I would look holistically at the situation. Women should obviously keep fit, so exercise, particularly weight-bearing exercise, can be very helpful. Some women also look at other forms of complementary therapy, herbal therapies, meditation, and so on. I'm highly supportive of all those forms of treatment because there is evidence that they can be beneficial. One of the commonest questions I get asked is, am I going mad? And is it just me? Probably because very few women associate the profound psychological changes that happen at the menopause with the menopause itself. Women often associate flushes and sweats and tiredness and joint pains and vaginal dryness with a lack of hormones, but they rarely link the psychological and cognitive changes, which are very real and actually in many cases can impact on their quality of life even more than the physical symptoms.